I remember I told my doctor when I was getting cut, I can't breathe. And she said, oh yeah, you can.
Francisca Shaw knew immediately that something was deeply wrong as she was being rushed into an emergency C-section.
And I ended up looking at my husband and started screaming, like, I can't breathe, help me.
It was 2015, the birth of her third child, Sania, now 9 years old, at Seattle's University of Washington Medical Center.
When they cut me open, they cut my uterus.
Shaw's ruptured womb caused heavy bleeding. She had to have a hysterectomy and went into cardiac arrest, according to medical records seen by Reuters. She was hospitalized for 3 weeks after the birth. The University of Washington Medical Center did not comment on Shaw's case, citing federal privacy laws, but said it was, quote, committed to ensuring high quality and equity in all of its patient care. Shaw, who now lives in Georgia, says the experience motivated her to become a doula, to support other women through childbirth. She feels that what she went through is emblematic of a long-standing problem in the U.S.
We know that this is happening. We know that Black women numbers are high, but it's not even just Black women. All women right now in the United States, the maternal health crisis is high for all of us. It's really sad about how many women are losing their lives because they literally just want to expand their families.
Shaw says attention to reproductive health care is critical for winning her vote on November 5th. And reproductive health advocates are trying to use the upcoming election to spotlight inequities impacting Black women, including higher rates of delivery complications and deaths. Black women in the U.S. are 3 times more likely to die from pregnancy-related causes than white women, according to the Centers for Disease Control and Prevention. The maternal mortality rate for Black women was nearly 50 per 100,000 live births in 2022. That's over double the maternal mortality rate for white women that year. The CDC and other health experts attribute the gap to underlying chronic conditions such as cardiovascular disease and hypertension, with structural racism, implicit bias from healthcare providers, and a lack of access to quality healthcare also contributing factors. In Georgia, Black people make up almost a third of the population. Nearly 16% of women there must travel more than 30 minutes to deliver at a hospital, a 2023 report from nonprofit March of Dimes showed. Nationally, fewer than 10% of women have to travel that far. Dr. Crystal Redman is the executive director of Spark Reproductive Justice Now, a grassroots advocacy organization in the state.
I think our communities are wanting to hear more conversations around equitable access, like at large, like how are folks getting care or being able to access care. We're not just talking about coverage, but like physical accessibility.
Public opinion surveys rank inflation and the economy as top priorities for Black women. But Reuters spoke to 10 activist groups that said they were aiming to mobilize young women of color around issues of systemic healthcare inequities. The effort is part of a 30-year-old movement for reproductive justice. It seeks to address equitable access to contraception and abortion care and higher rates of maternal mortality and certain cancers among Black women. Black voters are projected to account for 13% of the electorate on November 5th, according to the Pew Research Center. That's 34.4 million people across the country. Kwajalein Jackson is the executive director of the Feminist Women's Health Center in Atlanta.
I think people feel demoralized and scared about what is possible depending on who holds power. So helping people to see that they are not powerless, that when we combine our efforts and combine our voices, when we organize and we are clear about what we want to accomplish, that we still have power that matches or exceeds institutional power.
Many advocates believe these healthcare inequities are intrinsically linked to broader race and gender struggles in the U.S.
And in reproductive justice, we look at this overall journey to freedom and to liberation.
In Georgia, the issue has converged with abortion rights. Black women make up 13% of the female population in the U.S., but accounted for nearly 42% of abortions in 2021, according to the CDC. After the U.S. Supreme Court overturned the constitutional right to an abortion in 2022, Georgia banned the practice after 6 weeks, when many don't yet know they are pregnant. Former President and current Republican nominee Donald Trump has taken credit for overturning federal abortion protections. A Trump campaign spokesperson said in a statement that he has always made the health and safety of Black mothers a priority. Democratic candidate Kamala Harris has made abortion rights a central plank of her campaign and has spoken on Black maternal health at campaign rallies. Some experts believe Harris faces a challenge juggling two different constituencies. White women and Black women historically have different approaches to abortion rights and reproductive health care. Dr. Joyce Drayton is a board member for the Georgia Black Republican Council. She said that many Republican Black women, while opposed to abortion, would welcome stronger comments from Harris on improving outcomes for Black mothers.
We have absolutely no problem working across the aisle with anyone who, proposes legislation that gives better access to GYNs and transportation in rural Georgia.
In September, ProPublica reported on the deaths of two Black mothers, Amber Thurman and Candy Miller, who died after being denied abortion-related medical care. A rally for the women took place in Atlanta. Justice Gatson, she/they, a social justice doula and the founder of Real Justice Network, spoke to the crowd.
Our unity is our power. It is our duty to vote. Yes, it's our duty to organize and get in them streets. Yes.